ready. I make the motion to go back into regular session.
I make the motion.
Second.
It's 2:07 PM. Motion's been made and second to go back into regular session. All those in favor, say aye.
Aye.
And item number 9, we would need a motion to authorize another request for proposals for the dialysis clinic. And hopefully we can get something back from Mr. Zamora and Albert Payne on the progress, but so we don't lose time, let's put up another advertisement for 2 weeks,
I'll make the motion, please.
Second.
The motion's been made and second. All those in favor say aye.
Aye.
There's no motion on number 11, we're not gonna take anything. On number 10, we went to executive session on Touchstone Communities on negotiations and continuations with Touchstone. I know we have members of Touchstone, and I don't know if you wanted to present anything to the Commissioners Court today or to see where we're at. We talked about in December that we would need to meet or talk to see where some differences are. I think some information coming out from Touchstone on the employees seems to be different than what it's really being experienced at Touchstone. Meaning, what I'm hearing is some employees said their time was scaled back, but yet when it comes to the Touchstone management, said the time's not scaled back. You know, come on up there.
No wood. Mahal.
First of all, certainly want to, open by saying that, it's been our honor to serve the community of Cotulla for, almost 10 years now. Certainly the past 2 years and, an already challenging industry was, certainly very challenging with the pandemic and, Cotulla being a smaller community, a bit more challenging here to recruit from some of the outside markets for resident care. Now, right now, our patient population, we have a fewer residents than we customarily do. We typically run in the low 50s, mid 50s. Right now, we only have 42 patients. So whenever we have less patients to care for, then we don't staff those additional positions because it's not needed. You have enough staff to take care of the residents, and you're not having to hire agency to come in to staff the community. So, as far as our staffing levels, as far as ratio from team members to residents, that's never changed. Our per patient day PPDs has stayed consistent. So, we have had some turnover, unfortunately, in some of the department head positions now, and we have a couple of positions open that we're recruiting for, but that's certainly been a challenge, industry-wide. So many, nurses, nurse aides are going to work for the agencies now, and, hospitals, nursing facilities, home health, hospice, are, having to contract with agencies to staff the community. Now, we've made some significant progress in that arena. We had to use agency for a few months, but for the month of April, we were only had to use agency for 3 shifts for the entire month. And we've recruited sufficient staff to not use them in May. Of course, sometimes things come up, you have people that resign or, call-ins, injuries, things like that. But, I mean, we feel pretty confident that we're gonna be able to build back our census to our normal, 55 or so residents, and, you know, we'll continue to staff according to that ratio. Are there any other specific questions about staffing?
No, I know Touchstone has been with us for a long time, and it's been difficult during this COVID. It's been very difficult on everybody, not only that, on retaining staff. I know we guarantee Touchstone a fixed payment, and it has been negotiated a long time. You know, I think what's helped is that you have the QUIP and the other programs that kind of make up the difference, you know, that you brought to us. And people may not understand, but those are the programs we previously approved, to where we pay the money out of the county and then we get reimbursed, because that's matched on the federal level. So I know that's hard. And one of the concerns when we first ran the facility was concerns about HIPAA. That was one of the things that we had brought to Carl when I first met with Carl, because when you have an office, I mean, an entity that provides medical services, they're protected under, you know, HIPAA. I mean, so one thing that we find out sometimes is that employees come back and let the elected officials know of things that are going on, and they become HIPAA violations. And that was one of the reasons we had gone to Touchstone to try to cut this. And these are some of the things that's happened in the past, that some of the people are bringing up HIPAA issues that shouldn't be coming out and floating around. But when it comes to staffing, when they're cutting back staffing, we have a contract that guarantees 100% rate. So I know the staffing went down because of the, you know, COVID, and it's going to take some time to build the numbers up again.
Yeah.
So those are things that we should be able to work at and negotiate or see where we want to go through. I'm just one member of various members of the Commissioners Court. And you're right, it's very hard to manage long-term facility because there's not that many people out there, and even agency is strained. Agency, Commissioners, is if you don't have enough nurses, say you hire nurses, and for some reason they don't show up to work because the car accident, family issue, or something happens, some type of conflict, then there's agency where you can call and get nurses to come and fill in. You know, and they're nurses and they're going to be on the board, but many times when you use too much agency, you end up with nurses or medical professionals that are not familiar with the patients. And that's something that you run into. I know the contract is up in August, and it's something we have to look forward to. It's something that we need to make sure that not only the elected officials are happy with, but the people are happy too, and your workers are happy to make a decision, you know, on the operation. It's very important. I mean, we had an executive session. I think they want commissioners want to ask some more questions. They want to look a little bit more. So they weren't quite ready to say, you know, yay or nay, but I know it's a very important job that you do, and you've been through the COVID. We don't know if it's going to come back. You know, what are the true numbers for operations for the future with everything going up, you know, medicine's up, and make a very good decision, you know, that needs to be taken care of. You know, I think we got Dr. Rolf back there. He's a medical doctor. I think some of the technical reports that are getting very technical, that you need someone with medical experience to be able to answer on our part, is becoming difficult to do. But it's not an easy decision. You know, so I don't know, Commissioners, if you said you needed more time or not more time, or talk to your workers. I mean, it's not easy taking over a nursing home administratively, hiring, licenses, getting the insurance, it's not that easy. The issue, I guess, with the last person you had operating kind of created a disconnect. And, you know, and hopefully can that be remedied, you know, that's, I know she did good at the cook-off, I mean, she seems to be out there. I mean, and Rita seems to be out there, she seems to be struggling pretty hard at, we see her presence out there. And I guess kind of changing the attitude of some of the employees is gonna take some work. But, you know, where do we stand? I mean, Mary's concerned with the additional administration. Which isn't, so it's something she's never done if we take it over. And the issue, the Medicaid and Medicare billings, you need a special person that understands that. You know, it's not an easy task to come back and just take it over. For the commissioners, it's good. We vote and it's done for. But even after we vote, then the work goes to you all out there. And that's what's hard and scary. But apparently might be some employee issues out there. I know, I don't want to make her feel bad, but Margie's aunt's there, she said she likes the way it operates, you know. So, I mean, I think we need to get out there, look at it, and get a truthful idea of how it's run. I've been out there, and it's really clean. It's a very nice facility, and I mean, y'all kept it up, and it looks nice. But being able to bring our people back is good. Maybe that disgruntled employee that just got let go, maybe that was the problem. You know, and give it some time. But Carl, I know you've been doing facilities all over Texas now, and I haven't met with you, but how many have you had? How many do y'all have now?
We currently have 28 communities in the state, and we operate homes for the Texas State Veterans Home under a contract somewhat similar to what we have with the one thing you said a little while ago was that we were on a fixed fee. We're on a variable fee. It is that part is fixed, but it's based on the number of people we care for. So
I didn't remember, it's been a while, I didn't know there was a cap or a limit to how many you needed to operate.
There's a fallback that we put in mainly when we first came, when we first got here, because there was a lot of variables out there. And there was a cap put in the contract, I think it's at 43 residents. And so maybe we're kicking into that. I don't know that we're kicking into that, but if we average under that number, then you're right, there was some kind of deal there. But the real reason that was put into the contract originally was because we didn't know what we were walking into at the time. There were tons of variables, so I mean, if that's something that's a problem, we can probably get to a much better place now that we've been here for almost, I think, 9 years. We know the market. This business, and I think I mentioned this last time I was here. As a friend to the county, we want to make sure that the residents of Las Palmas are taken care of. We're going to be there to help in any possible way we can. And I think it's just as a friend, I know it's because we're the ones providing service now. It's hard for me to give advice, but being in this business because of the regulatory environment, because of the staffing issues. We're able to do things because of our size that you cannot do if you're operating, if you're a county operating. And I don't mean that I would say that to anybody that just has a few buildings. we're able to pull resources from 28 homes in the state of Texas when we get into buying. And so, like going through COVID would be, I mean, I can't imagine the regulatory environment, the reporting requirements that happened overnight. It's a very, it's like operating a hospital. It's, in some ways, it's harder. Our regulatory environment is harder than a hospital. And you're caring for people with real needs. And you gotta be able to staff it, and you gotta be able to, find nurses and find people. And it is just a real challenge. And, it's an expertise. And we have, I think in our presentation we gave last time, I think we added up, we got about $6 million in people that are invested in extra people just to be able to operate and manage nursing homes. And this just happens to fit really well for our company. We're in business in Pleasanton, Floresville, Del Rio, Laredo, Valley, a lot of small towns. And that's I guess my soapbox.
I mean, definitely the infrastructure, in smaller communities, they have some unique challenges, and certainly we do here. But if the community needs anything, let's say you couldn't get a hold of an agency nurse, then, we're gonna pull out of Laredo, the regional nurse is gonna come and cover the shift, and, she's had to do that, recently. The regional nurse had to come out of San Antonio and actually work a shift, a 12-hour shift, because agency was not available and there was nobody to work it. We were always find somebody to work it. We were never gonna leave the patients without the care that they need. So there's always someone to call. We're very fortunate here that we can pull out of Laredo, that's only, 45 minutes to an hour away, and we have 2 communities there. So we have resources here locally. Long-term care, our industry, it's the second highest regulated industry in the nation, right underneath the plants. Our regulations are this thick. Anything that you can imagine from, how much of an inch from the bottom of the door to the floor, to weights, skin, COVID reporting, infection control, on and on and on. So state surveyors can show up in our community at any time, and that actually occurred, recently. And when the community needs help, I worked all weekend here in Cotulla, 2 regional nurse I pulled to work in Cotulla, regional care and reimbursement I pulled to work in Cotulla, and we worked Saturday, Sunday, Monday, we're still here. We got that situated with the state, but that's the type of support a community needs, that you can pick up the phone, somebody's gonna be there. And that's the support that we've provided. It's been even more important during the pandemic, because certainly there was a lot of fear for team members and families, and we lost a good part of our industry workers through the pandemic simply because of fear, that they didn't want to work in healthcare any longer. So, certainly, a ton of challenges, but Cotulla's been such a wonderful community, a lot of great people here.
I don't mean to hammer on the other lady, because she also had to deal with the COVID, restrictions of keeping it shut down. So that's hard. But I do know some nurses, local, one that I've known for a long time, I don't want to mention her name, that is working elsewhere. And I've known her all my life, and she's an LVN, and she was concerned because in the past, so we're talking 2021, she was saying sometimes that she's the only one on the floor, and the DON wouldn't come in and help, so she couldn't handle it. But she really loved the patients. I know now that Ms. Adams is here, that she's already addressed the problems with the DON and some of the other nurses, and it seems, when I've been out there, the people seem happier. The people do seem happier.
Yeah, we have a local DON currently, which, we're certainly grateful to have somebody that's from the area. That's certainly hard to find. So yeah, we've been happy with that change, and we continue to develop her. And she's very new to long-term care. as is the administrator, just a couple of years' experience as a licensed nursing home administrator. So, I mean, we're completely willing and able, and will provide the support that they need to develop them into their positions.
And I think, we met in the executive session, I think the commissioners wanted a little bit more time to visit the facility, and if there's some people that reached out to them, get more information. I mean, get more information, because sometimes people, don't always tell you exactly what's happening, or their perception may be different. And the administration, it's not easy, so I know you're not, it's hard. I mean, we start thinking about it, we did hire a lot of agency too. A lot of agency, you can easily get into $10,000 or $20,000 a month in agency, because the nurses are expensive. The RNs are expensive. And the facility looks really, really good, so that's why I'm asking all of you, go look at the facility. It looks nice. I mean, it's really well run, well taken care of. But one of the things that we've had in a long time is being able to keep your partners for a long time. So you get a relationship with Touchstone, they've been here 8 years now, 10 years, something like that, Touchstone. And every once in a while you get a little kink where there's misunderstanding, you gotta get it resolved. But the resolution should be, one is, first, the care of our people there. Secondary would be the care and welfare for our workers there. That should be prioritized versus our elderly care, and the second, our people.
How many employees do y'all have? Employees.
I believe we're around 2,800 right
20, I mean, here.
now. Oh, here,
Probably ranging between 50 and 60. That's including like PRN people, part-time, that sort of thing. We've had, this community has been under, my watch. I've been at Touchstone for almost 6 years now, and, we've had good clinical outcomes for the 6 years. Haven't had any serious state issues. Our skin looks good in the community. The residents are certainly well taken care of, and we've been really proud of those clinical outcome and results. A lot of great things going on in the community, and although it's been the most challenging in our industry, the past 2 years, and we don't really know what's coming with COVID, we feel like we have the, infrastructure to, be able to handle anything that comes our way.
Y'all willing to redo the contract?
Yes.
Well, the contract starts in August, and that's where Jorge's been looking at the numbers. He's the one that's been working the QIP and everything else. Because I get a lot of the information from Lene and I go through it, but the reality is, Jorge is the one that has to deal with it, because it's, technical as far as the reimbursements. It takes some time to stay on board on all that. And it's, unless you've been exposed to the nursing home for many, many years, you're not going to understand it. You're not going to understand it. And the time that it takes to look at all that. But Commissioners, I know, what I understood today was, you want to find out more of what's going on your way. I'm sure you got your sources. Each of you have your sources to look at, but they're going to need an answer sometime within 30 days so they can start working on the negotiations of the contract, or not work on the negotiations on what you want. Because it takes time, but the operations management takes a while. The planning, the budgets, all that takes time. And, they need to know.
You just don't want to just say yes or no. We need to have a meeting with her. She's the one that thinks. If,
Oh, yeah.
yeah, over there. And
Well, I mean,
I just need more time.
like,
Go in there and talk to the people. There've been words going out that, I hate to say it, but, if we can,
yeah, that's what I mentioned before, that some of the employees have been maybe disgruntled, and they say things. And I don't think the commissioners want to burn them, but they're gonna have to go back and address them, say, show me something factual, show me something in writing. For example, one said, hey, we're only being paid 3% on our retirement fund, or 501, well, our benefits we're supposed to match, so it should be, 7%. Or the insurance, you said you took care of there's some people saying, well, they're paying insurance out of their pocket. Maybe it's a family member, maybe it's a dependent, maybe it's something else. But, I gotta go back to them and say, show me. I would call, look, they gotta understand. So, some of them may think they make more money on the county, they can work for the county, but the reality is, you're limited to the amount of money that's produced by the facility, regardless. The whole scope of the money that's being paid out are the revenues that you generate. And you generate them through Medicaid, Medicare, private pay, cash pay, and these other programs, the QUIP, the American Recovery Act, which are godsends. And that's it. That's the whole source of the revenue. So those employees and the county and Touchstone have to live within that parameter. And some of those employees may not understand that.
It's very, very true. And, what we get reimbursed in the state of Texas for Medicaid is 49th out of all the states. And so we operate in a very low margin business as just being a nursing home. So, and I think that's been some of the challenges since we came, right? It's figuring out how do we manage from a business perspective for the county.
Yes.
As well.
So, do you want to table that 30 days and then
Yes.
come back?
please.
Sorry, it's hard, it's a hard decision. It's not easy either way, but, but I think hopefully whatever decision is, it's made for the benefit of our residents. Raul, is that is there a second?
Second.
If there's any additional information, feel free to reach out. We can certainly make ourselves available to that, anything that you need to help you make the decision.
We will.
Yeah, I think Jorge's the one that has the best understanding of it.
The auditor.
Yeah.
Yeah, I'm gone next year, so he's gonna be the one with most experience, on that, Jorge. And so that experience, is gonna be solely vested in him. If he doesn't decide to retire.
You staying? We start looking for another.
So motion's been made and second, to table the item just for 30 days, and then let's see if we can, get whatever issues,
Have a good request,
done.
yeah.
But I do urge everybody here, including people sitting out there, go look at the nursing home, go sit down, go look at it, at some time. It's, for years and years, I went to the one to look at Pearsall, and it doesn't smell like, it smells nice, it's clean. You see the people happy, so that makes a big difference. Thank you, Carl.
All right,
Thank
thank you
you.
guys.
Thank you.
Appreciate it.
All those in favor say aye.
Aye.
All those opposed. Number 11, not going to take any action. Number 12, Mr. Shaughnessy explained to us, Mr. Campbell, the emergency services district and emergency fire district, and how it goes. So based on a petition, it goes to the city, Cotula City of Ensenada. Then it goes out to the voters. It's not something the commissioners vote on. It's something that it's voted by the public. I know I've spoken to Mr. Dovalina in reference to this because we passed a sales tax 4 or 5 years ago for emergency services, but all the postings weren't right, so we didn't do it. I think 5 years ago, 6 years ago, so well, right? And that was, it's not the first time, but the state is very limiting the amount of monies that you raise through property tax, very limited. And so all the values went great. Well, even though they go up and oil's at $100, you can only raise up to the limit of the taxes that were imposed the year before. And that's called effective tax rate. So if you go above 3%, you have to go out for an election. So it's getting tighter and tighter as the changes get in Texas to raise money, put revenue caps. So this is an alternative to be able to raise more money, you know, and get more services, but it's not a vote of the Commissioners Court, it goes out for elections. And I know you have a lot of experience, Mr. Dovalina, in dealing with those, and it's advantages and disadvantages, but it's not saying anybody's done anything wrong, is that the oil field fluctuates, and at some point, unless we start getting hard on some of the other sources of revenue, you know, some hard decisions are gonna be made. And I've said, even when, I've been trying to address them for a while, but people don't wanna make decisions because they don't wanna lose that vote, or they're afraid of their family, and they're hard decisions to make. But the numbers don't lie. We got a lot of people on the highway giving tickets, but the values haven't changed in 10 years. So we got millions of dollars that have not been collected or being dismissed, and it's going to affect how we operate in the future. So we're not going to take any action there, but once the petition is done and it goes to the city of Cotula, then they do the resolution for or against, and it comes back to us for verification, and then it's on the ballot.
And we're not taking any action because there's already a petition out there.
Yes.
That has been signed, correct?
There's a petition out there, but the process for the petition has to go to the city. Then the city votes on it, and they complete the petition, because they do their inside city limits or outside city limits. And then they, after they do their part, then it goes on the ballot. Then it goes on the ballot. And I know you haven't done that before, but we've done one before, like I said, it passed, but we didn't impose it because one of the notices was wrong. But it allows you to, you won't tax the fire department over here on the general side, and then you tax it over here on the ESD side, and the Commissioners Court appoint the first board of directors. And they can be either voted or staggered terms by the Commissioners Court, depending on what law it's been set up under. So, that's all I can say, just for informational purposes. I'm gonna cover, Shaughnessy's not here. I'll cover the next item. Number 13. Is it 2 years ago we started using McGinnis Lockridge? McGinnis Lockridge, and Shaughnessy's got on there, to start looking at probate cases, guardianship cases that haven't been filled. In Margie's office, she's already handled the criminal, right? The civil, all the Commissioners Court minutes, she's already microfilmed out everything else. The only thing needed was these other cases. And over the years, we've had a number of judges. I think we had Brown, we had Pottas, we had Lilo Martinez, Jimmy, and myself. And when someone dies, they file a will. And after so many days, there's a hearing. And they do declare who's going to be in charge according to the will, and they have to file an inventory. And that happens to probate, that happens to guardianships as well. So this year, the Court of Administration, Office of Court Administration came down, and they were initially looking at guardianships because we've had a number of guardianships. And they identified several cases that we have to account for and close. And some of them go back to, here's Mary Kay Witters, Martha Whitten Brown, Delia Amberson, which is my aunt, she died a while back. These are deceased persons that the guardianships have been taken care of, Roy Martin, Roy Sotelo, and then minors haven't reached age of maturity, so we got some going back to 1985, that they got to be closed out. And temporary orders that never came back. So sometimes the state would do temporary orders, so they got to be closed out. And some guardianships that never did what they were supposed to. So, and then you have some cases with final closure orders that need to be completely closed out, and most of these people are deceased, but they gotta close them. They gotta close them out, and they go many years. So I asked Shaughnessy to get started already because we're gonna have to take care of them. But like I told you 2 years ago, so we need to work on these things to get Margie caught up, and it's not gonna be a 1 year or 2 year solution because some of these, they gotta have court order notice. They gotta have court order notice. So that way you won't get surprised.
Thank you, Judge.
I think some of these cases go back up to the 1970s.
Yeah, 70s? And some of these people will tell you, for example, they did guardianship or they will, and they say, hey, you need to close it out. Oh, nobody will tell me what to do. And seriously, now the state's saying, hey, you gotta do something with them. You know, and that would happen quite a bit, but they gotta be closed out. And it's gonna take a little bit of work, it's gonna be a lot of work for your office, but I already told them to proceed, you know. So we have, you know, a lot of cases here, especially, in the people that have died. So, yeah, we have a lot. But I wanted to show you and let you know, I said, hey, you know, I thought the Shaughnessy go ahead and keep going because the state's gonna want us to get caught up with it. And there's nothing else we can do, but some of these cases are so technical that even the county employees aren't gonna be able to answer. And see, as county judge on these cases, I can't prepare orders for them, they have to prepare for me. So even if I know what to do, I can't do it myself. It has to be someone that pushes them to have a court for them to bring it to us. And that's the only way. So why did it get so bad? Because we can't enforce it because they gotta bring them to us.
The two ladies that came down to Florida, after they were finished and before they sent us in, they had have been doing this for several years, we've been going back to all the things. And I was asking, okay, how bad is it for us? She says, oh, no, she said, you're one of the few counties that has very little to do. It's correct. He says, you go to Toledo or some other counties, he says, no, those are really bad.
I mean, it still worked.
It still works.
It still worked, but at least we know it's not, you know, something Joel made up, you know, it's something that has to be done. And in many cases, sometimes people didn't want to close the estate because, oh, maybe something else will come in, you know, but they can't.
And I think since I've been here, maybe I've seen maybe 4 or 5 states actually finally closed of all the provinces we have. Not very many people closed.
3 weeks ago or 4 weeks ago, I had one estate on somebody I'm not gonna mention. And I said, you can't do this. He said, oh, yes, we can. And I said, Margie, go get the book. He said, I bet my license we can. And he was wrong. But those attitudes, when you've asked them, okay, when you get ready to close out, let me know. Oh, you're not gonna tell me what to do. So it stays there. He said, why move it? But now, this will help us, you know. We get someone that prepares them. And on McGinnis, I don't know, you go back when, how we came up with Mike Shaughnessy was, when we got into the appraisal district, remember? When we sued the appraisal district? Mossberger was going to sue the appraisal district. And I said, Mike, I said, the appraisal district's our problem, just let us use your lawyers. So Shaughnessy was the lawyer of Mossberger. So I said, why reinvent the wheel? You know, so that's how Shaughnessy came on board here. But this is only for information.
Yes.
Just to let you know, they're still working on this. It's gonna take a while, but it's not something que Joel, made it up just to get additional work.
It's been there.
But it won't take that long. Is there anybody's item that I need to address that maybe I forgot? Or that I haven't looked at? I know, Jorge? Let me get you started. I think that's why the city's here, right? Huh? Yes. So Larry, you know, we're not interested in our stuff. Huh?
It's interesting to see the other side.
Oh, on this?
Yeah.
To not to be on the other side, you see.
To see the other side.
Good. You want-
Morning, Judge, Commissioners, Jorge Martinez from Topside. Just item number 15, this is to discuss the bids that we received back March 24th for the TechStop grant project for Phase 1, which is the street paving in the Cotula area. We received 3 bids. In front of you, the total bids that we received from, in order, South Construction for 3.697, 757, Anderson Columbia, 4,155,852, and CK Newberry, total bid of 4,599,483. We reviewed the bids, the unit prices, the submitted documentation, and we're recommending at this time to propose a schedule for us for review.
So we have to go with the
The
lower
last
bid.
time I talked, you said by June, you were gonna start on phase 3, ya vamos mitad de plan.
Behind.
So phase 3 más o menos when will
Next
it
year's the
start?
last one, that one's gonna be probably done out in June. And the problem with phase 3 is we had a set amount of budget from the state, so the county may have to supplement if they want to do the full-blown package, because these were a little higher than what was estimated on the grant. Phase 2 is gonna be higher than what was estimated because of the security
Then
costs.
let's cut off on this and cut off on that, and let's do the same amount on every phrase.
Like on the lowest bidder, Salle.
Time out, time out.
Oh, go ahead.
You're not gonna cut, I was there, you're not gonna cut off on one
No, I think we'll.
to do
we'll
this
all of
one
them.
and this one. Phrase 2 no estaba ni en el meeting. The guy from phrase 3 was there on that meeting. You're not gonna cut me way out and me being present.
No, so part of the reason why I moved to phase 3 is that the city was